You hear me? Hello?
Yes, yes.
So we can hear
You
you.
are looking great and amazing
Uh,
with
So
shaved
Thank you,
head.
sir.
okay, so we are starting. Um, Hello, I'm Pallavi Mahajan, Marketing and Communication Head, Brainpreneurs Child Development Center. This pandemic, because of COVID-19, has taught us a lot in terms of being filled with gratitude for what we all have and being responsible for spreading out towards human race what all we can. On similar lines, Brainpreneurs Child Development Center has taken up an initiative rising above ourselves under which we are conducting this webinar. First of all, I would like to introduce our panelists to you. Dr. Sushil Razdan, MBBS, MD, and DM in Neurology from PGI Chandigarh, a renowned neurologist having over 45 years of experience in medicine. He's an expert in neuro-related ailments. Dr. Naresh Kaul, Senior Anesthesiologist, ICU, and trained in MOH, Muscat, Oman. He's also heading the Anesthesiology Division. He has been practicing for 40 years now, a frontline corona worker in both ICU and operations theaters catering to corona patients. Dr. Shweta Razdan, Senior Breast Fellow in Firmly Health Foundation Trust in Slough, UK. She's trained in general surgery and is planning to be a breast specialist. She also worked in breast unit in India for 6 years before moving to UK for last 2 years. She is also a frontline corona worker. Shambhavi Deval, clinical psychologist, Brainpreneurs Child Development Center. She's also a psychotherapist who specializes in CBT, REBT, DBT, parent management for ADHD and autism. She has an experience of 5 years in the field of clinical psychology. Dr. Rohit Pandita, BPT, consultant physiotherapist at Brainpreneurs Child Development Center. He's been practicing from last 3 years. Dr. Sirat Nabi, BPT, MIAP certified stroke therapist from London Academy, consultant physiotherapist at Brainpreneurs Child Development Center with almost 2 years of working experience. And Sunaina Tikku, life coach, special educator, NLP happiness coach, and CEO of Brainpreneurs Child Development Center. Apart from this, she also has 20 years of global experience in HR and corporates. What's commendable about the panelists is the fact that every one of them during these difficult times have been rendering their services to the society and helping patients and or family of COVID patients either directly or indirectly. So I would like to say a big thank you to everyone for being a part of this panel. We know a lot has been talked about COVID-19, but it is a vast subject to explore as medical professionals and as general public. So with the help of our esteemed panelists, we will be talking about COVID-19, psychological and physical care during COVID-19. With this, I would also like to take this opportunity to introduce Brainpreneurs Child Development Center. It is a team of different specialists and therapists coming together to work for kids with special needs. Our team consists of doctors, clinical psychologists, child and adolescent psychologists, special educator, occupational therapist, speech therapist, physiotherapist, cognitive research scientists, life coach, career counselors, art trainers, and many more. All of us are here together to help you as much as we can. So with all due permission, I would now like to move forward and start with the questions that we have for the panels. So to begin, I would like Dr. Razdan to please, throw some more light around COVID-19. So there have been things going about COVID-19, wave 1, wave 2, black fungus. So as a doctor, how would you give us a little more insight to what COVID-19 is and how does it spread around?
Thank you, Pallavi. Good afternoon, my friends, Dr. Naresh from Muscat, Dr. Shweta, Shambhavi, Sirat, Rohit, Sunana, and all others who are viewing this. I think we have been living through this pandemic for last 1.5 years, and If I start like this, on 30th December 2019, the Chinese authorities informed WHO that they have seen some serious pneumonia cases due to SARS-2. In fact, if I go back in 2002, there was a SARS-1 flu influenza in East Asia, and about 800 people died that time, but it got restricted to the area. Then in 2012, there was a similar influenza in Middle East, which is known as Mediterranean SARS, and about a couple of thousand people died in Saudi Arabia. And this was this virus jumped from camels to humans. Therefore, we had some idea about it, and soon after this information was conveyed, Wuhan and Hubei started having a lot of deaths and lot of cases were there, and it was in news. But everybody thought that it will remain localized there, which it was not so. It was a Lunar New Year in China, and most of the this New Year is a lot of visitors and Chinese, especially from all over the world, come to Wuhan and Hubei province. About lakhs of them came. And then they went back to their countries, to Europe, to North America, etc. And then we started having cases from UK, cases from USA, and most of the cases were from Europe, especially Spain and Italy. That is a very recent story. And we in India again thought that it is in those areas. We also started having cases in February in south of India, from Kerala and Bombay. And they were mostly travelers. And by mid-March, we had hundreds of cases from India. And third week of March, I very well remember, I got scare second, third week March, when we had some cases in J&K, and I closed my face-to-face clinic on 17th March, and within a week we had a national lockdown, and a lot of cases came up. But the first wave, in retrospect, was not huge, and deaths were also not huge. Then due to the precautions and masks and lack of gatherings, the flow ebbed, and we can say the river got frozen. We had only 10-15,000 cases per day from all over the country, from say September, October till January, and everything started again. Universities started, factories started, festivals started, marriages started. And I told you the river was frozen. It was not, the virus was not eliminated. And those, and more travelers came from Europe. There was a second wave there. We already had cases in our country also. And the new surge started in March from a couple of states, Kerala, Maharashtra, Chhattisgarh, even Delhi. And soon the whole thing got engulfed again. And this time the wave has been so huge, 4 times the previous one. And again, the deaths have been 4 times the previous one. I think I'll stop it there, and then we can have more questions. Back to you, Pallavi.
Thank you so much, sir. As you said, the river is frozen, but it has again started flowing. And it is not something that is restricted just to India. So we are in a global pandemic, and it has made the whole world boundaryless. Every part of the world has been hit in one way or the other. So we have Dr. Naresh from Muscat and Dr. Shweta from UK. So if we could ask you also that how has the pandemic hit in your area? So if you could start with Dr. Naresh, and if then Dr. Shweta can add all to it.
Yeah, thank you, Pallavi. You know, Oman is a small country with a population of 4.5 million, and the pandemic started here along with any other part of the world. And I tell you, from January 20 until now, there are about 2 lakh of cases, 2 lakh 9,000 to be precise till today. And most of them have recovered as we have gone through this pandemic. Because of the sparse population, people use the social distancing and masking and all those things. The effects were not as great, and the number was maybe as per population ratio, if you take it, it was more. And if you look at the deaths, there were 2,240 deaths till now. Even what's happening now is Oman followed the rest of the world, as you put it, in your, you said that there are no boundaries. It's a world which is one country probably today without borders with severe pandemic going on. And the destruction is same all over, and somewhere it's less, somewhere it is more. But due to lockdowns and other things, it got restricted here overall in the Middle Eastern area. And because of the Ramadan and the Eid and celebrations, everything was closed after 4 o'clock basically, so that the people could not meet, and this restricted the things. Not like like many parts of India, as marriages and as Dr. Sushil put in back, the marriages started and gatherings. There were underground gatherings. This is one of the main problems during this pandemic. Like any other part of the world, Oman also has seen two peaks, one last year and now this year, and it plateaued around 25th of April this year. And now the daily addition of cases has dropped down from 3,500, which happened to 5 to 700 now cases per day. And a lot of deaths have been reported now. There are about 250 patients admitted in the ICU. Like any other part of the world, Oman has the same problems. Lockdowns, the economy is down, the unemployment is there. There are many issues around, whatever you name it. There are all the government and the private hospitals have been converted to COVID areas, and patients who require oxygen and ventilation are being admitted to the hospital. In fact, our old airport has been converted into a field hospital, which admits patients who require oxygenation basically. One thing is important, that we are using one standard treatment in every center as per the guidelines of the Ministry of Health. There is no other treatment given of your own choice or anything. And all the patients, as I said, do receive the same treatment. And coming to the vaccine part of it, like any other country, we have this vaccine hesitancy here as well. And to tell you, any patient who got admitted during this second wave in our hospitals, they were not mostly vaccinated. Even the patients who are on ventilator. In fact, we are now on a study how many patients had received 1 dose or 2 doses of vaccine and they are on a ventilator. The good news is that all the vaccinated persons, they get mild to moderate issues and they have good recovery as well. That's very important, to start with. In other parts of the Gulf, when you say, Saudi and UAE and Qatar, there is zero cases addition nowadays. No cases are there. And there have been cases there also. In fact, Abu Dhabi was the first country among the Middle East which started with the vaccine, which was long, long back, in fact. I think vaccination has helped definitely this part of the world, definitely. And most of the people, as I said, who got vaccinated first and second dose have lesser symptoms and signs. They have mild to moderate disease. The recovery is much better, much better, much better. That's overall what has happened in this part of the world. Yeah, Pallavi.
Thank you so much, sir. If I could request Dr. Shweta also to, put in her thoughts also what is happening around UK.
Hello, good afternoon, everyone. The story is same everywhere. This pandemic has affected everyone, you, me, in one or other way. I will just try to give my experience working here in NHS. So just briefly, what is NHS? NHS means National Health Service, which was started in 1948 by the government of UK to provide free healthcare service to every citizen of UK. So it's a free healthcare service. Even now it includes everyone who lives in UK, who is from immigrant, who is an immigrant or working on a different passport, they can get NHS services. So I just want to share how NHS handled this crisis for last 1.5 years. When this pandemic was declared as an emergency on 31st January 2020 last year by the UK government, it asked its policy makers in the NHS to make an action plan how this pandemic, how they are going to work in this pandemic. So action plan was made within 2 weeks, how to handle this situation. The first plan was to increase the capacity of beds in all the hospitals. So all hospitals in UK are under NHS control. So they are run by NHS, though there are private hospitals, but they are not under NHS. These private hospitals were taken up by NHS, and all patients who could be discharged from hospital were discharged and were handled by community hospitals by their GPs, general physicians. So main priority was to empty the beds in hospital and increase the critical care capacity. The second was to maximize the support staff. They needed support in form of health workers who will work for these patients. So for that, they called around 10,000 retired health professionals, doctors, nurses, and other health workers. They were re-employed. They collected around 6 million volunteers from military services, from social services, from other private sectors. They mobilized around 6 million volunteers. Plus, they nursing students, other healthcare workers who were still studying, which was around 27,000. They were all included in the NHS. And who already were in the NHS, they were redeployed, including myself. I was redeployed to another department to help the in this COVID crisis. So this is how they mobilize the support staff. They start in last year when there was surge of first wave, they started 7 new hospitals were constructed in whole UK. And one hospital with a capacity of 4,000 beds was, I think within 4 months it was made. So even one hospital was made within 9 days. So they made 7 hospitals in different parts of UK. Plus, they did training for simple things like training for mask fitting was compulsory for every health professional. Training of wearing PPE was compulsory for every health professional. Even simple hand washing training was mandatory for all health workers. This protocol was followed in the first wave, and when the second wave they started getting cases in November, I think starting November. This protocol was again followed from December, and till for 3 months this was done. Just want to mention all elective surgeries were postponed or cancelled for 3 months so that they could have more beds and more anesthetists who could deal with these patients in ICU. So to mobilize that staff, all elective and surgeries were postponed. The emergency surgeries and urgent surgeries, including cancer surgeries, they were done on a priority basis. I want to mention something about vaccination. So vaccination was started as phase 1, which started in December. In phase 1, all healthcare workers, including the frontline workers, all vulnerable people who had some underlying disease, all this people who live in care homes and their carers, I think they all were included in phase 1 and they got vaccinated. The phase 2 was started recently, which has included all people above 18 years. Till now, above 40 years, 91% of the population has been vaccinated. And just to mention this new, the Indian variant of this virus, there are cases around, till now, 2000 cases has been detected in whole UK, the Indian variant, and they have been found who haven't received vaccination and in younger age group. Thank you. Back to you, Pallavi.
Thank you so much, Dr. Shweta. As we said that this pandemic has made the world boundaryless, and more or less it's been everywhere. The impact might be a little different, but it's been impacting the whole world. And as Dr. Naresh and Dr. Shweta said, it's a very new thing. Even the medical professionals are, on their toes, exploring new possibilities and trying to help us as much as we can. So we can, as general public, what simple things we can do is taking care of our hand washing hygiene, wearing masks whenever we are going out, if it is necessary, maintaining social distances. And that is how, at least from our end, we can, create a difference, and we can at least minimize the spread of the virus. So I know these are very basic things, but it's always to repeat it to ourselves and others so that people understand, and we kind of repeat everything that's necessary and important at this time. So as our panelists had also talked about lockdowns and, the basic practice that we've been doing since 2020, I wanted to ask you, Shambhavi, that this phase has taught us a lot. We heard that we used to listen to this in our school, that man is a social animal. But since pandemic has hit us, isolations and quarantine have been a thing. Like they have been practicing, or corona curfews is a new thing that India has been practicing. So all these things can lead to loneliness, and it takes a toll on our mental health, which can in turn hamper our physical health. So what are some of the ways to take care of our mental health according to you during quarantine or home isolations?
Right. So thank you, Pallavi, first of all, and I would like to thank Braintrainer's and Child Development Center for having me here. So yes, as you rightly mentioned, we are isolating ourselves as a precautionary measure against the spread of the infection, and it is taking a toll on our mental health. And we are completely unprepared for what are the effects of loneliness on mental health. So there are research evidences which talk about effects of loneliness and as a factor which defines poor mental and physical outcomes. So if you want to be physically fit, it's very important that we are mentally sound as well. So I will be talking about a few things that we can do while we isolate ourselves at home. So number one is keeping ourselves on a schedule. I know it's very difficult to maintain a schedule when you're isolating and there is no time for anything. But this is a way of keeping our mind on track, that you follow a schedule and try to stick to it as much as you can. Also make a list of a few things that you would like to do for the next day. This will keep you motivated and you will have something to look forward to for the next day. The second important thing that we should all do is, I think, limit our exposure to social media in terms of purposeless scrolling. So when I talk about purposeless scrolling is we spend a lot of time on social media, and I would like to say that if we make it meaningful for our own mental health, that would be beneficial. So rather than just spending time on Instagram, Facebook, and other apps, and we all have this thing that we have fear of missing out when we see other people doing things and we are isolated. So to work on this, it is important that we connect ourselves to our family members or friends or our colleagues at workplace, and we can have virtual meets with them. So this will help us to keep ourselves connected with the world virtually. So that is also an important thing. So yes, definitely limit your purposeless activity on social media. This is going to definitely help you to prevent anxiety and fear of missing out, and also comparison. All these things can be prevented here. The third important thing I think is it's a good time to learn something new. So let's take it as let's take this time as a time that we can start learning a new art or do-it-yourself gardening activities, or it could be learning a professional skill that would help us to evolve. So all these things can be learned, and we can pick up a new hobby.
Can I just request everybody to be on mute other than the speaker, because then the speaker could just talk about more clearly. Thank you so much.
Yeah. Another important thing that we can all do is talk about how we feel. We can find a person we can trust, and let's talk about loneliness and just vent out your feelings to that person. And there are a lot of platforms which are available. There are professionals who are giving out help. So just reach out whenever you think that things are getting out of control. So it's important to talk about your feelings. And lastly, I would like to add that practice gratitude. Think of all those things that you're grateful for every day. We can make a list of all those things that we're grateful for. And gratitude is also linked to better mental and physical health outcomes. So yes, definitely practice gratitude, and it does help to combat negativity which is there around. So I think we can practice certain things, what I mentioned, and that will definitely help to combat loneliness. Thank you, Pallavi, and back to you.
Thank you so much, Shambhavi. As Shambhavi rightly said that, we've been using this time to explore technology not only as a medium of getting onto social media and all, but also as a virtual platform to connect to everybody, because we as social beings cannot actually live in isolation. So, but it doesn't mean that if we are in a house alone, we cannot connect to other people. So it is also a request from our side as well that please do connect, call your friends, your family members. We can anyways be in touch with them and can take care of our mental health to a great extent with all these practices. And as she said, a schedule is really important. Thank you, Shambhavi. These were great tips. Thank you so much. And now I would like to ask a question to Dr. Rohit. So Dr. Rohit, you as a physiotherapist have been taking care of patients right from the day we've been seeing you, right from when the pandemic was, had just gotten out of hand. Even then you were catering to patients. But what, according to you as a physiotherapist, can be a major contribution to the society during this pandemic from your side?
Thank you. Good evening to all respected panelists. First of all, sir has already discussed about the disease, COVID pandemic, 19 pandemic. So I would like to add, there are various viruses like filoviruses, lessiviruses discovered in the bats to humans. So the COVID is also a form of from bats to humans transferred. So it has started from the, as we all are aware about it, from the Wuhan city of China. So let's discuss about the cause of this. What disease causes? It's basically the respiratory disease, SARS-1 and SARS-2, severe acute respiratory disease 1 and severe acute respiratory disease 2. It's a type 2 variant, which we are experiencing nowadays. And the transmission is like people and surfaces. People, a infected person exhales. It transfers from infected person to uninfected person. Surfaces, if a person touches on the surface, it is also, and then to nose, to mouth, if a person touches, then it also can be infected. The person can also be infected. Now, I'd like to discuss about the preventions. Preventions are used alcohol-based sanitizations, maintain social distancing, wearing mask, minimum gathering, avoid gathering, I must say. So there are various, as a physiotherapist, I would like to explain some of the some protocols and techniques to cure the patients suffering from COVID-19. First of all, when the patient is in ICU, the patient is being intubated on the ventilator. First of all, being a physiotherapist, my main goal would be to assist patients' range of motion, manual muscle testing, patient's weakness, and active range of motion. These all the parameters are almost reduced when a patient enters in the ICU and the patient is on ventilator. So I will, there are three phases. Basically, there are three phases in which we can cure the COVID patient. The three phases include first phase. In the first phase, it will be totally based on the evidence-based practices. Like, first of all, I will check it out the heart rate, temperature, pulse rate, blood pressure, and SpO2 for the particular patient. Another thing would be the patient would be on steroids. The patient to regain the immune system. Manual muscle testing will be done to examine the patient's muscular strength, and initially active range of motion will be passive range of motion will be started, because the patient is not able to move the patient is not able to move legs, arm, both upper and lower limbs simultaneously. So the passive range of motion will be started initially, and in the second phase, all the vitals are mildly improved. So the same thing will be practiced again in the second phase also. Like, passive range of motion will be performed on the patient. All the vitals will be examined again. In the third phase of this treatment, the patient is almost improved. The patient's vitals are also almost improved. So patient is able to move his leg. Patient is able to move his legs, arms, both upper and lower limbs. So we advise patient to walk properly and live independent life. So these are the three phases in which we can cure a patient suffering from COVID-19. Thank you. And again, in the post-rehab COVID patient, in the post-COVID COVID patients, rehabilitation in the post-COVID, so the same thing will be followed, but under the supervision of physical therapist. So these are the protocols and techniques which I will follow, and the physiotherapists nowadays are following during this pandemic.
Thank you so much. Thank you, Dr. Rohit. So this was a very insightful answer that he gave about how a medical professional, a physiotherapist, can help the patients. So we have another physiotherapist with us, Dr. Seerath. So Dr. Seerath, I would want to know, like, what are some of the breathing exercises that patients can do when they are COVID positive, and how can they increase lung capacity? Also, because if they have to do it themselves, what are some of the precautions that should be kept in mind while performing these exercises?
First of all, thank you so much for this question, ma'am. And I'm blessed and honored to be the part of this webinar. Okay, let me talk first about the breathing. As we all know that because of COVID-19, breathing process hampers first. As breathing is the most important process for living. As breathing involves two types of processes, the process of inspiration and the process of expiration. Breathing is the amount of air that a lung, breathing exercise. Now, let me talk about first the breathing exercises. Breathing exercises are those exercises which helps us to help the strengthening the muscles of respiration. Muscles of respiration are those which helps in breathing. These are there are two types of muscles of respiration. First is the inspiratory muscles. Second is the expiratory muscles. Inspiratory muscles are the main inspiratory muscle is the diaphragm, which is the dome-shaped muscle which is present in our abdomen. And during breathing process, this diaphragm contracts, and the amount of air enters in our lung, and we are able to breathe, and our rib cage expands. So the amount of air enters in our lungs. Same is the process with the expiration. This diaphragm retracts, this diaphragm relax, and the rib cage retracts, and the amount of air comes out of the lungs. So the breathing process is complete. As a physiotherapist, I recommend each and every individual, including the COVID positive patients with mild and moderate symptoms, that they should perform breathing exercises at least 3 times in a day, because breathing exercises increase the vital capacity of the lung. Vital capacity is the total amount of air that a lung can hold, and this lung capacity is very important for the gaseous exchange. It means that the oxygen can take in, and the waste product, which is carbon dioxide, it comes out of the lung, and because of this breathing process, this gaseous exchange take place. And as we all know that in COVID complication like in pneumonia, lung deteriorates with time, and the lung capacity for the gaseous exchange decreases. By performing these breathing exercises, this lung capacity increases. Breathing exercises reduces stress. Breathing exercises induces relaxation. It also teaches the COVID positive patients who have shortness of breath or dyspnea that how to deal with these episodes of dyspnea. Also, there are a lot of breathing exercises which include diaphragmatic breathing exercise, pursed lip breathing exercise, segmental breathing exercise, lateral expansion exercise, chest expansion exercise, huff cuff technique, and many more. But I am telling here as a physiotherapist that according to Indian Association of Physiotherapists, the guidelines for the COVID positive patients who have mild and moderate symptoms, whose oxygen saturation is around about 88 to 90%, they can do diaphragmatic breathing exercise, which is really important for the strengthening of the diaphragm. As I already said, that diaphragm is the primary muscle of inspiration. And secondly, by performing these exercises, following are the precautions that a person should have to follow during while performing these exercises. First, once the patient is doing these exercises, when he takes a deep breath, after that he has to hold the breath for around 5 to 10 seconds, or firstly, he has to go slow around, he has to stop, hold his breath around 3 seconds. Then he or she has to expire. While doing the expiration, the process of expiration should be very slow, because if the process of expiration is forceful, because of forceful expiration, the bronchospasm can occur because of increased turbulence. When the bronchospasm occurs in our lungs, the muscles around the lungs become tightened, and the gaseous exchange does not take place. Second precaution that the COVID positive patients has to follow, that if he feels any sort of discomfort while performing these exercises, like if he or she feels any sort of chest pain, chest pressure, he should immediately stop the exercise. If the blood pressure is fluctuating, it means that if the systolic blood pressure of a patient is above 180 and diastolic is above 90, he or she should stop immediately doing these breathing exercises. Secondly, if the patient is performing these exercises and he feels sort of discomfort like coolness, clumsiness, giddiness, that he or she should stop doing these exercises. And now talking about who can do these exercises, breathing exercises. I'm saying as a physiotherapist that everybody can do these exercises, including the normal healthy individual, because the breathing exercises also improves the ventilation process. Secondly, a child can do these breathing exercises. A pregnant lady can do these exercises. In fact, a patient with mild, moderate symptoms can do these exercises. While the patient who is COVID positive but is on ICU, but is on ventilator support, or he needs oxygen, then Indian Association of Physiotherapists has made a guideline for those patients that they can do a technique which is called proning. It means that lying on his or her belly, he can do this activity under the supervision of the physiotherapist in the ICU, because proning is a technique which improves the oxygen saturation of a patient. Thank you. Over to you, ma'am.
Thank you so much, Dr. Seerath, for such informative answer. And while we are talking about patients being hospitalized and everything, one thing that comes out in form of good news is the recovery rate that's been recorded. So if I could ask Dr. Naresh, what are the some of the practices or exercises that one should practice during the recovery stage or post-COVID, to lead a healthier life? What could be some of the suggestions that you would want to give them? Dr. Naresh, you're on mute.
Yeah. Most of the patients, let me first tell you, when the patients are on ventilator, they are being ventilated with a machine through a tube which is in their trachea, or what you call as windpipe in layman's terms. And when this any person who comes out of an operation for 1 hour, 2 hours, 3 hours, I'm sure has experienced this. When the tube is removed, they feel soreness in the throat, and then they find a bit difficult to breathe, and they will say that my chest feels tight. Now, a COVID patient who is on a ventilator with a tube in for maybe 2 weeks, maybe 3 weeks, maybe whatever the time, what are going to be the problems? It creates a lot of problems, basically. One of the important things that happens is trachea. There's a, below the vocal cords, there can be a narrowing, and it narrows the passage, and it becomes a difficulty in breathing. So it creates a lot of trouble. Secondary infection has taken place, and all those things. Once these patients come out of the ventilator, basically what happens is that, there are numerous write-ups. You can go to Google and find out a lot of write-ups, and everybody's neighbor is a doctor, and everybody advises everybody. But I would advise just follow the treating doctor. And then there's a wonderful write-up by the WHO that's called as WHO leafletter. That's important for these COVID, post-COVID patients. And it gives very nicely how to manage breathing, how to exercise after leaving the hospital. It's not only breathing, you have to manage eating, drinking, swallowing. You have to manage problems with your attention, memory, and thinking, because you have been on a ventilator. You have been depressed. You have to manage the stress problems with the mood, and then all other daily activities, basically. Just to add to when one of the physiotherapists told about this breathing exercises, there are various positions one should adopt. One is if you lie in supine position with your face facing the ceiling, or you can lie down on the side, but you should have pillows under your shoulder, under your neck, and under your head. That means the head end of the side is raised. This, this helps you to breathe better. You can sit on a chair and lean forward on the chair and on a table, or without a table, or you can stand besides the chair. I can give you an analogy. If you can see this, you have a bottle of water. Man is standing like this when the bottle is half full. The lower part of most of the blood is in the lower part of the body, and less is towards the lungs. So you breathe better, right? And when you put this bottle like this water goes throughout the body. The breathing becomes a bit difficult in this situation. That's why I told you to just do a head up tilt, put pillows under the head, and you will definitely breathe better. That's the best way to breathe. I always advise even the patients who come out of the operation that keep them in head up tilt position. About 20 degrees, the breathing becomes better. And then sitting and leaning against the chair and all those against the wall, it makes you come comfortable, and you can breathe much better. The other thing she has told you about the inspiration and expiration, I don't need to explain that again. And then, while you are breathing in and out, that's called as controlled breathing techniques. You can put, your hand on a chest and an abdomen one over the hand, and you can feel. And just for the best results, keep your eyes closed. And that relaxes you much more. Slowly breathe in through the nose and breathe out through the mouth. You can, if the nose is blocked or something, you can breathe in through the mouth as well. And use as little as effort as possible. So do it in a better way. So this is the breathing part of it. Then these exercises as they advise you to do after leaving the hospital, they're mostly done to improve your fitness, to increase your muscle strength, to increase your balance and coordination, basically the thinking and the stress. And very important for these exercises to do at a right level. Don't do it at, do a warm-ups first. Don't start running. First, just walk around and then start running. You can do exercises for the lower limb. You can do exercises for the upper limb. As these, under the guidance of the physiotherapists, they will be the best people to do it. And when you talk, your voice is also affected because of this ventilator with the tube in the throat. So don't try to, strain your voice, and don't whisper also, and don't shout also. All these things, they put a strain on the vocal cords, basically. So talk whatever is at your comfortable level, and slowly it will improve definitely. And just hydrate yourself and eat proper diet. It will help you a lot. And always eat and drink and swallow. Best position is in a sitting position, upright position. Otherwise, the aspirations can take place. We can produce secondary complications. Always very important. Now, very important are these activities of stress, anxiety, depression, attention, memory, and thinking. I think Dr. Sushil will be the best person to more, but I can just tell you the headlines. The brain exercises mostly try to involve yourself in hobbies, the activities, and do the puzzles and the word numbers. They help you think, and it gives you it exercises your brain, basically. And try to read certain things, adjust your expectations, and other people should also help you to do these things. Manage your daily activities. Try to reduce your stress and anxiety, pace yourself, have a good sleep. As I said, be active physically, and stay socially connected. Very important. One of I think Dr. Pranita said that stay socially connected and try to listen to music and other things. This will relieve your stress, basically. And at any time during this process, during this exercise, breathing exercises, or any other thing in post-COVID days, if you feel nauseated, you feel dizziness, if you feel lightheadedness, a shortness of breath, if there's a sweating and a chest tightness, always go to a referring physician, and he will definitely guide you better. He will definitely guide you better. Thank you, Pallavi.
Thank you so much, sir. That analogy was so beautifully put to make everybody understand the process. And I would like to request every panelist, anybody who's within your own medical or clinical experience, whatever you want to suggest or want to tell us how post-COVID, what are some of the ways, if you would like to add on as well.
Pallavi, can I
yes,
ask a
yes,
question?
Yes, Dr. Hasan, please.
I have a very, we are fortunate to have Dr. Kaul with us. Dr. Kaul runs, probably the viewers don't know, he has been running COVID ICU for last 1.5 years. He heads that unit. I think they have over 30 to 40 beds. Is it, Dr. Naresh? Am I right?
Yeah, we have about 30 bedded ICU, plus we have a separate isolation ward. And then we have very important, I want to add, we have patients who come for surgery during this COVID area. And the patients who have been tested are positive, but I have seen many of the patients, they tell us on second day, this patient has tested positive. So we are exposed, we are trying to take precautions for every patient, but it's not possible, right and left, whosoever is on your, who is moving around you, suddenly we come to know, but we do masking and other things, and that's how it is important. That's how it is important.
I have, thank you, Dr. Naresh, to take it further. I have a very important question for audience, for you. How do you motivate yourself, your staff? You have been going day in and day out. You have to work with COVID patients. You yourself are a human being. There will be always some fear, some fear of something. How do you keep yourself motivated physically and mentally? And how do you take your staff? How you have a big staff? How do you, from paramedical staff to staff nurses to your doctors, how do you keep them motivated? Then I have another question for you after that.
I remember when this COVID started, everybody was so scared with the name itself, and people were hesitant to work in the COVID area, let me tell you. Even the doctors, the nurses and paramedics, everybody. But things today are totally different. Probably we are used to it, and then we are taking much more precautions and taking care. But then we don't have to be complacent at any time, because if you lose that track, okay, I will not wash my hands and all those things, then the problem starts. But now today we are much better off. I think the time has taught us this thing, and then taking precautions over this 1.5 years has helped people to know that if you take precautions, nothing is going to happen. Most probably you will be safe and you will be happy. And then I had to rotate people. I would not send the people who were, say, 55 or 60 plus to these areas mostly. We were trying to avoid it. But then if there was no choice, we had to do it. I remember one of the young doctors who was intubating a COVID patient. He ran into trouble. It was a difficult intubation. And one of my colleagues and me, we were standing outside the door of the theater. We had to run in even without N95 and intubate. Otherwise, that patient would have died. Now that patient is alive today, basically, and we were praying to God that we were all safe. This is how it happens sometimes. But the people have been kept motivated only because we have rotated them. We have made them, understand that everybody has to work in this area. There is no other way. We go slowly. We give them ops. We tell them to work in different areas, and that's how we have been able to do it. That's the only way. And believe me, from 1st of January 2020, most of us have not taken even a day off till today. I can tell you about me, I have never taken even a day off during this period. But then slowly we have to, we keep on thinking that we have to do this, somebody has to do this, and it has to be done. And then taking precautions, very important. I must be washing hands at least 200 times in 6 hours, in the morning hours when I am in the hospital. And the sanitizers and other things, and all these things. I don't know, it has become a habit now, basically. That's how we have been able to do it.
Can I ask you one small question? In your ward, there are patients who are not unconscious. They are almost alert. You may sedate them, keep them muscles relaxed for intubation. Some are on their own breathing. They are without their attendance. There are no people are not allowed to see them. They're away from everybody. How do you motivate those patients? How do you have empathy for them? How do you talk to them? How are they? They don't get say scared, or they don't get loneliness, or how do you do that in your ward?
Most of these patients are kept in isolation, in separate rooms. All these COVID patients are there, and they are only attended probably just for a visit by a nurse and a doctor, and then they come out and then they are looked after. whenever they require something, they have an alarm system. But mostly in the suppose our old airport has been converted to a field hospital. It's not segregated. There are patients around lying in that ward, and probably they see each other. There are transparent barriers through which they can see each other, and the doctors keep on moving and nurses keep on moving and talking. But let me tell you, most of them are frustrated. They are angry, they are depressed, and everybody doesn't know what is going to happen next. It's such a thing that has happened in the last 1 year. Very, very, very difficult situation which is there. But the patient who is isolated in one room, I have talked to some of them on phone. It's very scary to do this. That's why they get depressed. This post-COVID business, this exercises, mental exercises, this is very important for rehabilitation of these patients. This is one of the, I am thankful to you. You have done this thing on the seminar on this on rehabilitation. It's a very important thing for these patients, basically.
Can I ask a similar small question to Shweta?
Yes, sir, please.
Shweta, you were posted in COVID ward for some times. When you do a round of those patients, in addition to medicines, do you talk to them? What do you talk to them? What do questions they ask you? What COVID patients के क्या सवालात होते हैं usually doctors? When you do a round.
These patients are usually isolated. Not only the nurses and doctors are there to talk to them. So we tell them to make them motivated. We tell them to talk to their family on phones, do some video calls. These days, digital platform is there. So they do call on the to their loved ones on digital platform. That is how they get engaged. Our nurses, they motivate them to be positive, and they will get soon, and they will go back to their home, to their loved ones. So that's how it works here. Otherwise, yes, these days, during that lockdown and second wave, no attendant was allowed to hospital except the patient. They had to come on their own, or the attendant had to drop them outside the hospital, and the nursing staff will then take them inside the hospital. So attendants were not allowed to enter the hospital. So it was a very hard time for a patient, especially in ICU or in a isolated wards. So digital platform has really helped them to be in touch with their near ones and talking to a patient that everything will be sorted out, everything will become normalized again. That is how you motivate your patients.
Dr. Naresh, please.
Naresh, you're on mute.
Can I add something?
Yes, sir, please.
Yeah. When patients are in ICU, they are on a ventilator. This, what we are talking is not applicable. So they are on a ventilator, on sedation, so it doesn't. This is more important for the patients who are on oxygen, who are conscious and talking to you and looking at you. I remember in olden days, there used to be wards and operation theaters in certain hospitals where one side of the building used to be having a glass so that you can look outside and see what's happening outside. Nowadays, if you go into the modern theaters and all places, everything is closed, not a single place where outside or anything, or even in the wards. It's a very important thing. Now, with this pandemic, I am feeling that there should be an area for such patients where one side is all transparent. They can communicate at least with the roadside or building or outside. Something is happening, and have an area outside from where they can even talk to the loved ones. Only these WhatsApp videos and other things probably is helping them right now, and this is what is happening right now, basically. Yeah.
Pallavi, it's back to you.
Thank you.
Thank you so much, sir, for these questions. One thing that we have been grateful to all the medical professionals nowadays, like we call them Corona warriors. But this conversation make us realize that when we talk about patients, we talk about our known relatives and everybody else. But what doctors go through is not just a medical emergency, but also a mental level of stress where they see their patients struggling and sometimes getting into a zone where things are not known that much. So hats off to all the frontline workers, all the doctors practicing during Corona times, all the clinicians practicing during Corona times. And now moving forward, if I could ask Ms. Sunaina Tikku that, the pandemic has changed our whole life, especially the foundation years of children, because, schools are shut. There are no interactions that the kids can do with their friends. They can't have their playtime. They do not go to family functions or meet their extended families, except for the video chats, if those are happening nowadays. So, what is the advice that you would give them to normalize, though these are not normal times, but again, we as humans have to be hopeful. So can you tell us, like, what would you advise them that can help them normalize their foundation years as much as possible?
Great, thanks, Pallavi. A great question. And I must first and foremost thanks to the entire panelists. It's a beautiful conversation that's going on where we are seeing a very good balance. The caregivers, the clinicians, the doctors, it's on one side, what's going on and how much of stress, as you just rightly said, that there's so many things that are happening today in their lives. And on the other side, we have patients, we have people, and the world has changed a lot. So definitely this is having an impact on children. If I may say that there are around 1.2 billion children globally who are out of school at this point in time. And, I always remember that old saying, it takes a village to raise a child. So at this point in time, it's very important that not just teachers, not just caregivers, not just, society, our relations, parents are playing the most important role, because most of the time the child is at home. And although a lot of educational institutions have come up and they are doing e-learning programs, but sorry, just a minute, they're doing e-learning programs, but still a lot of responsibility is with parents, is with the environment that the children are in. So if I may say, there are around 5 stages of development, and these stages mainly include cognitive development, emotional and social development. We talk about fine motor skill, gross motor skills, we speak about speech and language. All these stages are very important for the child. And now with this pandemic, children being at home, I urge that all parents and caregivers, they should pay equal attention to all these stages for children. It's very important, and I think it has been highlighted, by our psychologists, by the doctors in the panel. Very important to maintain discipline. Food, habits, sleep, all these things are very important. Discipline, having a timetable, a consistency in the way we are leading our days. We do not have to become lethargic on any of the days. And parents are the role models at this point in time. Therefore, they should watch out how they are managing the day. It's important for children to do constructive and purposeful things during the day. And above all, I would say enjoy. This is the moment. Every challenge has its own bliss. This is an opportunity for all of us who are safe at home to spend time with children, relish these moments. Because once, hopefully, when things get normal, we are back to our course. This time will become precious. So all these things are important, and I think parents, as a society, teachers, caregivers, everybody has a role to play. Thanks, Pallavi. Back to you.
Thank you so much. And as Ms. Tikku said that, every school, every training institute have now started e-classes. It's been like a thing from last 1 year or so. So I do understand when, parents have the inhibitions about e-learning, but when we can have the kid looking at a cartoon series or a YouTube on phone, then why not a class on phones? Because I don't think that learning should be stopped, because if anything, learning is a process that can go on at any point of time. And it does seem a little difficult because it's a new thing for us, but even in Brainpreneurs, we have tried e-sessions, and they did work out really well, and the kids enjoy, and they now look forward to it every time we have a session. So that means that we need to be a little more persistent in all our efforts, and once we start doing it with all enthusiasm, zeal, they will yield results. So the stop should not be there, I think, because we are still in a state where we don't know how long this pandemic is going to be, what the situation is going to be post-pandemic. So at least we can tackle the situation as it is today, rather than stopping everything. Thank you so much, Sunana ma'am. This is a very nice conversation and very useful thing that we need to get on and be with the time. We cannot race against it right now. So moving forward, as we were talking about sessions and learning stages in schools being shut down, there's a very important question that I would want Shambhavi to answer, that if we have been in this field from 2-3 years, Brainpreneurs Child Development Center, and we do understand as professionals that it is very important that early interventions should be practiced. As soon as you have a diagnosis, early interventions prove to be very useful, especially in case of kids with special needs. So how do you think parents, we can help them understand trainings that has to be imparted to kids with special need during these times?
So it's a very good question, Pallavi. So first of all, there was a research done in efficacy between online and offline training programs for parents who had children with special needs. And during the research study, the efficacy between online and offline was almost the same. And I mean, there was not much of a difference between the outcomes. So a lot of times there are a lot of inhibitions when it comes to online sessions, that, will the sessions be beneficial because the child is not coming to the center and there are a lot of restrictions. So yeah, according to a research study, it is definitely beneficial, and it is important to start early intervention when it comes to children with special needs like autism spectrum or intellectual disability or any type of learning disability. It could be anything. So the earlier we start, the outcome is better. So I think parents should be vigilant about the stages of development for children. And as it is, children are at home right now, so they're not getting as much as social exposure, which is required at that particular developmental level. So parents should take care that they are getting enough exposure in the family, and enough interaction is done with the children in the family itself. And yes, definitely online training session, even though there are a lot of inhibitions to start with initially, but they are definitely beneficial if we compare it to the long-term benefits of online intervention.
Thank you so much, Shambhavi. As I said earlier also, I don't think that this is a time to stop. We need to move on, as probably with a slower speed, probably with a new pace, with a new way, but we can't stop right now because of the pandemic.
Absolutely.
And that was a very insightful answer. Thank you so much. As Shambhavi was saying, I would like to take this opportunity to tell everybody that we at Brainpreneurs Child Development Center has taken up an initiative under which obviously we are doing this webinar also, which is called as Rising Above Ourselves. And under that initiative only, we have created one series which we call as Become Your Child's Therapist. So we don't want parents to feel helpless. We are, as an organization, as a group of experts, as a group of professionals, are trying to help them, where we are kind of training the parents to, be the therapist of their own child. Obviously, there are years of training behind a professional, but we will help you as much as possible. We, along with our team, will try to train you as much as possible. And we want that, this be a time when the bond between the families increase. And, additionally to that, the trainings don't stop, because, at the end of the day, family plays a major role in the development of a child, any child. And that is why we are right now really appreciating a lot of parents who have been, in this with us. And any other organization, any other therapist, please contact them, take little help and guidance, and try to, not take a pause and continue the trainings of your children. So now I would want to ask Dr. Shweta, if she could tell us that, self-care and family care at this point of time is really important. So what would be some pointers that you would want to give our audiences for the same?
Thank you. I would just like to mention that right now family is in this COVID times, you are stuck with your children and your family inside the house. So try to make maximum out of it. As everybody said, make a timetable for your children, engage them in some daily activities which they enjoy. Don't argue on things, small things, like just if a child is not agreeing on thing, just go with the flow of the what the child wants. So try to involve all the family members in some daily activity, so that even elderly, so that they get engaged in the time. Otherwise, even elderly don't have any other thing to do at home. So try to engage them in some activities, any indoor game, any cooking sessions with elderly and with children. So just engage everyone. Be passionate to your family members and your children. Engage to other family who are not near you. So engage with them on social media or any digital platform. That's it. Thank you.
Thank you so much, Dr. Shweta. And before moving towards questions that the audiences have from us, if any of the panelists would want to give a concluding remarks, please.
Can I talk now?
Yeah, sure, sir, sure.
I just want to emphasize the people, for all viewers, etc., that you have to understand that the most important thing in control is the pandemic, in addition to what you know, vaccination, masks, etc., social distancing, hand washing, is the way family takes care of each other. And the most other important is how the society takes care of healthcare workers. I am all the time seeing for last so many months or years, we only talk about oxygen, pipes, flow meters, tubes, ventilators, beds. We never talk about people who have to run them. You must have heard a ventilator, to run a ventilator, to run an oxygen supply, you need the man, you need an anesthetist, you need an anesthetic technician, you need a doctor, you need a nurse, you need a healthcare worker, you need a pharmacist. We should talk about them in all the time. We never talk about them. You see any channel, any media, these people are hardly talked about when they will make a difference. It's no use getting 20 ventilators. Who will run them? You don't know how complicated it is to run a ventilator. It is a science. It takes 5 years to get training how to run that ventilator properly. And here we are talking, every Tom, Dick, and Harry starts giving oxygen himself or herself. It's very strange. I think we have lost the focus. The people who will make a difference to treatment of COVID patients will be healthcare workers. Please talk about them. improve their morale, motivate them, encourage them. They themselves are human beings. They are tired. They are burnt out. They are fearful. You take care of them, give them their due, encourage them. Don't unnecessarily be harsh to them. They may make mistakes, but they don't do it deliberately. It can happen. Human errors happen everywhere. I think our main idea is to speak about our healthcare workers who are in hospitals and outside hospitals. Unfortunately, the whole agenda has been taken by people who have nothing to do with medicine, like administrators, by magistrates, by courts, by politicians. They have no idea about it. They have an idea. That's why it's very important. It's very important that this health care of COVID patients has to be in the hands of healthcare workers. The others have to support them. The government has to support them. Civil society has to support them. Everybody has to support them. But the primary, this is the core. This is the core. If you take care of this core, everything will get there. Thank you, Arvind.
There are questions. Pinky coach.
Please, sir.
I'm not able to sleep properly. What should I do?
Pallavi,
is somebody speaking? No.
it's back to Pallavi.
Yes, so Dr. Naresh wanted to say something. Yes, sir, please.
I remember, when Rajiv Gandhi, I think he was the man behind this digitization. When State Bank of India, it was said that it will be computerized. The whole of State Bank came on streets of India to have a strike. Then if the banks are to be run by computers, what about the people? But as Dr. Sushil put it, the man behind the machine is very important. That he should know how to do it. Even if you have to set up an oxygen cylinder, you must know which pipe to get, what pressure regulating valve you have to use, what flow meter, what flows you have to give, which mask you have to use. This is a different science, basically. And I have seen over, as he put it, on TV channels, all the big people of the big hospitals talking, but the proper people are talking how to do it, basically. I have never seen on a single channel the persons who run the ventilators is an anesthesiologist and a respiratory therapist. I have never seen.
I'll interpret for a second. I have never seen epidemiologists, public health workers, anesthetists, ICU people, or general practitioners talking. Everybody else is talking.
And it is very important that the proper people do the proper jobs. I have been running ventilators for the last 40 years. I tell you, if you give me a new ventilator today, I have to get myself trained for 5 hours to know how to run it. The knobs are different, the configuration is different, the connections are, everything is different. It takes, basic principles are same, but then you have to know how to do the machine.
They get, Dr. Naresh, they get these ventilators to every hospital. They are dumped there. They are dumped there. Nobody knows. There are not enough anesthetists around, ICU people around to run them. We've lost the focus. We've lost the focus.
As Dr. Sushil put it, at the end of the day, I must say no head of the government or no government can tell you how to do it, and they cannot do anything about this COVID situation. They can just give you the infrastructure. They can get you the equipment. But the main thing has to be done, main prevention has to be done by the public itself. You cannot bring a policeman to be after everything. We will need the population of India, you need same number, one policeman after one person to follow the. I was watching a TV just now. Why they are showing why you are not putting a mask? So they are laughing at this correspondent. I mean, unless people do it themselves, nothing can be done. You have to avoid parties, you have to avoid contacts. And very important, nobody says this thing. You may laugh at it, what I'm going to say. One should not laugh and talk too much when you are 3, 4 people, even in a hospital or doctors. If you laugh and talk too much, you are producing more droplet, this thing. Try to talk minimum and do not laugh, and do not stand at the same place for a long time with the same people. The viral load and the time of exposure, that is very important. We talk about high things, but these small things, this can only be done by people themselves. No government can do this. We will try to blame everything on a government. Nothing can be done. I loved Dr. Devi Shetty's talk with Rajdeep Desai when he told him, even a country like USA who have the best medical facilities could have dealt with the people what happened in India. People are forgetting what happened in New York last year, Italy last year, and second wave of UK when everything was down. So it all depends upon the people, and that's it. That's the end of it. Thank you, Father.
Pallavi,
Thank
all
you.
I just wanted to add on, I think just taking a moment out to salute all the health workers out there. And again, I mean, maybe you will also summarize it for the audience. Very important that we need to do small things at this point in time. And I think Dr. Naresh told some very simple things, that need to be done, whether it's about talking less, not spending too much time in a closed area with same set of people. And above all, we as citizens, I think whenever we are sending messages, let's be very sure about what all is being sent. A lot of things which is not authentic, where we do not know what is the source, I think by not sending them and being very careful about what we are spreading as news, I think we can act as responsible citizens. So thank you so much for all the advice that has been given by this panel.
Very well said. And as Mr. Ku said, that we need to be a little more responsible, and we do not need to spread news that we're not very sure of, because we're not experts. We're not qualified for all the checking on the information if it's right or wrong. So we need to be like really responsible in what we are spreading, what words we are spreading around. So moving forward, there was few questions, and if I could put them forward towards the panel. So the first question is, I am a mother of 5-year-old epileptic child with mild seizures. Once the vaccine are permitted for children, is my child eligible for COVID vaccine?
Once they are allowed in children, an epileptic has no contraindication. Safely, he or she can do it, but it should be first allowed. The trials are on. Once the trials come out, they show that they can be used in children, then only use. Don't do it now.
Thank you, sir. And as Dr. Naresh also said, that the best person to consult, or in one of the answers when he was giving, he said that the best people to consult for all these things is your consulting doctor. So do seek help medically for all such queries, because that's the best way you can do. Next is, after COVID, I'm not able to sleep properly. What should I do?
I should.
Sure, sir.
This is a very common complaint post-COVID. In fact, a new term has come up, which will be used more often now, because now after the COVID, you have a post-COVID period. This is known as long COVID. A lot of patients will have symptoms of anxiety, of fatigue, of concentration problems, memory disturbances, and insomnia. And I think with the passage of time, this insomnia should improve with proper sleep hygiene. The person should not sleep during daytime, should avoid caffeine beverages, have a little stroll in the evening, have early dinner. Don't listen to news and negativity all the time. And I'm sure with passage, they may not need drugs for that. But if it is still resistant, one can consult general practitioner, family physician, or a doctor whom the person knows. They can give a mild tranquilizer for some time, which is not habit forming, or even melatonin can be used. But I think that should be taken after advice of the family physician. It will go off. I am sure it will go off. Yeah. This is a very common complaint of long COVID insomnia.
Yes,
Dr. Naresh.
Adding to what Dr. Sushil said, if you engage yourself in activities during the day and don't sleep during the day, and sort of do a lot of physical activity and sleep early and to socialize, talk to people on a digital platform, and that will reduce the negativity, and probably this will help over a period of time to go into sleep. And
True,
if
true, very
you
true.
continues, go to a doctor, as you put it, this one can take the medication, but under the guidance of a doctor, you can always do that.
Thank you. And somebody wanted to add? Okay, so can we move forward to the next question? If a person tests COVID positive, after what time period that person should be vaccinated?
If he gets COVID positive, see, COVID itself gives you immunity for some time, and the guideline is after 3 to 4 months you can get vaccinated. About some months back, it was even earlier, after 6 weeks. Dr. Shweta, can you add up more?
Here in UK, any patient who had got COVID, within 4 weeks, they can have the vaccination. So 4 to 6 weeks is the guidelines here.
Can I add something?
Yes, sir.
Yeah, you know, this, I would like to convey to the audience, and you can even talk to the people about this thing, you know, whatever is being said today is being said on the available evidence, what is present today, right? And this evidence keeps on changing after every 3 weeks, 4 weeks, or 5 weeks. All these questions only can be answered after 10 years when you have enough experience, enough this thing. And then you can make good amount of literature to go through, and then you can talk about this. But at present, we have to go by the available evidence, which can change even on a daily basis, I tell you. Like a person who gets COVID, who has got antibodies, probably he's safe for 3 months or 4 months, and then he can go in for a vaccination. That is the guideline in the Middle East also. Now, latest issued yesterday, that you can have those people who have got COVID positive do not need to get vaccinated for next 3 months. So it will be done after that. It is like that everywhere. Probably same thing would apply to India as well. Thank you.
Okay, so moving forward to the next question. So because it is a little unpredictable nowadays, so people are really worried about the transmission. So there's this question related to that, any survey that COVID virus can be transmitted through groceries, because that's one thing that people can't stop taking.
Can I answer?
Sure, Dr. Naresh, you're on mute if you're speaking. Yeah. Yes, sir.
Can I answer it?
Yes, sir. Yes, sir.
I think Lily asked this question.
Yes.
Lily, the proof is that COVID-19 spreads mostly by airborne. Airborne means either as droplets or in aerosols from person to person. That's why Dr. Naresh was I liked that one-liner. Don't talk too much, don't shout, don't cough, don't sneeze, don't laugh. Then you wouldn't put this virus out. And then it goes out, either it drops on some surfaces, but mostly it is inhaled as aerosols. And it can remain suspended in aerosol for hours if the air is stagnant. That's why indoors are much worse than outdoors. The emphasis initially on surfaces has been lessened now. Probably it's not so common mode of spread by touching surface, though you should be very careful still, but mostly it is spread by aerosol. We don't have a percentage wise how many gets involved if they touch a surface, or how many, but mostly people get it by airborne. Airborne is the current evidence.
Yes, Dr.
Naresh. You know, probably what the evidence today, I can tell you the personal evidence. When we go to the market to buy things from a grocery store, the advice is always get the things and leave them in your, in one of the rooms in one of the corners for some time, leave it for 1 hour, 2 hours. You know what, I can tell you the personal experience, I leave it, and then I even take this bleach, I spray the bleach on top of it. I do it regularly. And then after some time, I'll take it to put it in the proper places. My point is, if the COVID has to spread through these things, then there would have been many, many cases of this COVID who would have been exposed to these things and would have got it probably. As if Dr. Sushil said, it's mainly through inhalation and all those things that it can spread. When you leave it, just nothing happens. That's the best evidence. Everybody goes to the market, so gets the things. Wash your hands after that with soap and water, then just that's it.
Thank you so much, Dr. Naresh. And another question, if we could take on. So my daughter tested negative in RT-PCR test. However, she has developed 107 antibodies in antibody test. Does that mean she has COVID? She had COVID.
Yeah, if the antibodies she had sometime back. If the antibodies to COVID are there and the antigen test was negative, she had this COVID infection sometime back, months back.
So it might not be a immediate response. The antibody. Okay, it's not. Okay.
This happens. Many asymptomatic so-called patients did antibody tests after months. They were raised. That means they had got asymptomatic or mild infection, which was very minor.
Okay. Thank you so much. I think we have answered almost all questions as well. And this was a great conversation. Also, what I really liked, one of the viewer has written, which we were just talking about, we are responsible for ourselves and our families. We should take precautions. And this is the same lines that we would want to request the audiences, as you know, we've established that it is something that we can't be dependent on a government body, only doctors, or only a particular you know, set of health workers. We have to be responsible for our own selves. We need to maintain the social distances, that distancing that has been given as guidelines. Your hand hygiene has to be maintained. The mask has to be there. One good thing about all the webinars is that we don't have to put on the masks, and you know, we can, as Dr. Naresh said, don't laugh out, you know, big time, but we can always have these smiles. We can have these smiles with our mouth closed, and we can be at least grateful that we have this opportunity sitting here talking to each other. And you know, we've been here now because so much have been lost during these times. But again, as I said, that you know, humankind, as I always say, that humankind is a very optimistic species. So we always look forward to tomorrow, and we always have our plans made, and we're sure that you know, we are in this together. It's tough time, but we are going to go through it. And again, a big salute to all the frontline COVID warriors. They've been taking their own personal life at, you know, not even second stage, but a third stage, fourth stage. And the first stage for them are their patients, are the people that they are taking care of, all the clinicians, all the medical professionals. Thank you so much from all of us. And again, a big thank you to all the panelists for being here for all these conversations. We know we've been talking about COVID-19 a lot, but as I said, it's a vast subject. It's, as Dr. Naresh said, that we can't, anything that is new today will be old in another 3 weeks, and there'll be a new study. So we need to talk more and more on it. We need to be aware, and we are here to help you. Any kind of psychological, any kind of physiotherapy related problem, please do contact us, or any kind of, you know, we would like to request our panelists also that if we anytime get any kind of, you know, questions that need to be answered, we'll try to contact them and try to get the best answers possible. So please stay in touch, be hopeful, and be responsible. Thank you so much, everybody. Thank you.
Thank you.
Thank you, everyone. Bye-bye.
Thank you.
Thank you, everyone.